What are common symptoms of coronavirus? A coronavirus is a type of common virus that can infect your nose, sinuses, or upper throat. They cause symptoms similar to upper respiratory infection, including runny nose, coughing, sore throat, and sometimes a fever. In most cases, you won't know whether you have a coronavirus or a different cold-causing virus, such as rhinovirus. But if a coronavirus infection spreads to the lower respiratory tract, your windpipe and your lungs, it can cause pneumonia, especially in older people, people with heart disease, or people with weakened immune systems. How is a coronavirus infection treated? A coronavirus is a type of common virus that can infect your nose, sinuses, or upper throat. You treat a coronavirus infection the same way you treat a cold. A humidifier or steamy shower can also help ease a sore and scratchy throat. Get plenty of rest. Drink fluids. Take over-the-counter medicine for sore throat and fever, but don't give aspirin to children or teens younger than 19. Use ibuprofen or acetaminophen instead. What are common symptoms of coronavirus? A coronavirus is a type of common virus that can infect your nose, sinuses, or upper throat. They cause symptoms similar to upper respiratory infection, including runny nose, coughing, sore throat, and sometimes a fever. In most cases, you won't know whether you have a coronavirus or a different cold-causing virus, such as rhinovirus. But if a coronavirus infection spreads to the lower respiratory tract, your windpipe and your lungs, it can cause pneumonia, especially in older people, people with heart disease, or people with weakened immune systems. Coronavirus 2020 outbreak. Latest updates. News about the coronavirus outbreak that started in Wuhan, China, is changing rapidly. The respiratory infection, which is closely related to SARS and MERS, has been spreading across China, and cases have been diagnosed in several other countries, including the United States. We'll provide the latest updates on cases, deaths, travel restrictions, and more here. What is the latest news? The CDC confirmed the 7th case of the disease in the U.S. in a man from California. The man had recently returned from Wuhan and lives in Santa Clara County. How many people have been diagnosed with the virus, and how many have died? According to European CDC, the majority of the confirmed cases 11,818 are in China. Another 134 are confirmed outside of China in 23 countries. These include Thailand, Japan, Singapore, Taiwan, Malaysia, South Korea, United Arab Emirates, Vietnam, Cambodia, Nepal, the Philippines, India, Sri Lanka, Germany, France, Italy, United Kingdom, Russia, Finland, Spain, Sweden, United States, Canada and Australia. All reported deaths have been in China. What do we know about cases in the United States? The 7 U.S. cases are in Illinois, Washington, California and Arizona. The CDC in total has 241 persons under investigation for coronavirus from 36 states. In addition to the 7 confirmed positive, 114 have tested negative. The man in the most recent case from Santa Clara County was never sick enough to need hospitalization, health officials said. He is in stable condition and is self-isolating at home. In addition to the Santa Clara County patient, California has 2 others, one in Los Angeles County and one in Orange County. The patient from Orange County is a man in his 50s. He is in a local hospital in isolation and is in good condition, according to the Orange County Health Care Agency. Los Angeles County officials did not provide additional details about the patient there. What are public officials doing to contain the virus? The U.S. and the WHO have declared the crisis a public health emergency. The U.S. is banning any foreign visitors who have come from China from entering the country. All U.S. citizens who have visited China's Hubei province in the past 14 days will face mandatory quarantine for 14 days. Other visitors returning from China will be screened and asked to self-quarantine for 14 days. The State Department has issued a Level 4 travel advisory telling people not to travel to China because of the outbreak. Is travel to China safe? The U.S. State Department issued a Level 4 travel advisory telling people not to travel to China because of the outbreak. Some cities in China, such as Wuhan, are closed to travelers. Travelers who do go should avoid contact with sick people, avoid animals, animal markets, and products that come from animals. Wash their hands often with soap and water, or use an alcohol-based sanitizer if that's not available. Seek medical care right away for a fever, cough, or difficulty breathing. Tell a health care professional about any travel. What are the symptoms, and how is the virus diagnosed? China created a test for the virus and shared that information with other countries. The CDC has developed its own test. Symptoms include a fever, coughing, and shortness of breath. They may appear 2 to 14 days after you're exposed to the virus. What is the source of the virus, and how is it spread? Health officials are not sure of the source of the virus yet or how easily it can spread. The virus can spread from person to person. A new case report published in the New England Journal of Medicine describes how a woman from China infected 4 co-workers at a German company before she showed any symptoms of the disease herself. The CDC believes that severe acute respiratory syndrome (SARS) and Middle East respiratory syndrome (MERS), 2 other types of coronavirus, are spread through droplets when someone coughs or sneezes. Is there a vaccine? There is no vaccine, but the National Institutes of Health is working on one and hopes to begin testing in several months. That testing would be for safety. If it's safe, there would be testing to see how well it works. How is it treated? There is no specific treatment for the virus. Patients are generally given supportive care for their symptoms, such as fluids and pain relievers. Hospitalized patients may need support with breathing.